Okay, our recording has started. For those of you who have not joined us before, welcome. For those of you who have joined us in months past, welcome back. This is our November edition of the Indiana Grown for Schools Network 2022 webinar series. So number 11 of 12, we are almost there with this webinar series. So thank you so much for joining us this month and all months prior. This month, we're really excited to have some presentations on local food in the healthcare space. We're hoping that our other presenter will join us in a little bit, but to get us started, I'm going to hand it over to our friends at Parkview Health and in the Northeast region with Mary and Michelle. I will let them talk a little bit about their program and who they are and how their partnership works, how they became our two presenters today. And then we will have questions. If our other presenter isn't able to join us today, we will have these wonderful folks present for us, and then we can end early. For any of your colleagues who weren't able to join us today, or you guys want to view this recording again later, it will be up on the Indiana Grown for Schools YouTube page and then linked into our website, so you guys can find it in both locations. We just ask that you give Brianna and I a little bit of time to get it downloaded and edited and uploaded and all of those fun things. So hopefully before we're going on and enjoying our Thanksgiving holidays, we'll have that up for you. So Mary and Michelle, I'll hand it over to you and you guys can kick us off.
Perfect. Thank you so much.
Okay, great. I will start sharing the presentation. Is that the right one? I think it is. Is that working?
That's perfect.
Okay, great.
Awesome. Hi, everyone. My name is Michelle Beaujrab. I am the lead community outreach dietitian for Parkview Health, and I am the project director on our Veggie RX to Heal program, along with a few other projects that we have going on. I have a wonderful colleague with me today, Mary Tyndall. Mary, do you want to go ahead and introduce yourself?
Sure, absolutely. My name is Mary Tyndall, and I'm a program officer for the St. Joseph Community Health Foundation. So I focus on nutrition security here in Allen County.
So today, Mary and I are going to be talking a little bit about some of our community initiatives and partnerships that we have in Allen County and how our local health system is working to improve healthy food access for all in our community. And our partnership with the HEAL initiative, which stands for Healthy Eating, Active Living, began back in 2014, where we identified areas in our community of need for healthy access to fruits and vegetables. And we'll talk a little bit about that. But our partnership really speaks volumes in our mission and vision as they align significantly in that we focus on well-being for our community. And through that, goal, we work together on several initiatives, but HEAL was one of the first founding initiatives that we have. So HEAL, like I mentioned, starts for Healthy Eating, Active Living, which really is to increase access to healthy foods in low-income, low-access areas, formerly known as food deserts. And this was to increase affordability of healthy fruits and vegetables locally grown for low-income vulnerable populations. And also we have increased awareness of educational opportunities to improve diet and cooking skills. And we have seen increase in fruits and vegetable consumption among participants through the access and the education. And we know that the significant role that diet plays on a person's overall health. So reduction in heart disease, diabetes, high blood pressure, and obesity. And we came together in 2014 to improve some of the areas with these low access points for community members. And so we found in our community about 1 in 5 children are identified as food insecure. And we, in 2020, were higher than the state average for food insufficiency rates. And so we know that we have a problem in Allen County that we continually try to address. And we partner with not only ourselves, but we work with many corporations such as Fort Wayne Community Schools, all sorts of different agencies like Health Visions, Big Brothers Big Sisters, Boys and Girls Club, to really work on our initiative for the community. So HEAL is a two-pronged program. We have our access points, which is our market, which you'll be hearing from Mary in a little bit. And then the other part of our program is our Healing Kitchen, which is a garden to kitchen curriculum. And it is a train the trainer model. The curriculum was designed by a registered dietitian. And then the registered dietitian actually teaches like individuals in the community to go out into small nonprofits, churches, government agencies to teach the curriculum to the members of those organizations. And we teach them healthy principles such as how to safely handle food, how to stay safe in the kitchen, how to measure, how to mix, how to cook. And it's a really fun curriculum, and it's a way for the whole family to get involved, or the whole community to be involved. So we do discuss different practices such as knife handling, safety measuring. We really talk about the dietary guidelines and how those affect our overall health. And in this picture, you will see today throughout our whole slide deck, a lot of participants that have gone through the HEAL program, but this picture specifically is a lady who has been a facilitator of the Our Healing Kitchen since the infancy of the program. Her name is Denise Porter. She works for the Fort Wayne Housing Authority, and she actually hosts classes in the different housing complex that we support with our initiative. So I just wanted to share that. But a lot of the activities for the program discuss like trips to the farmers markets, gardening tips, preservation methods, and different games and activities throughout the classes. We really want these recipes that we share to be affordable, tasty, and healthy, and achievable for participants to replicate at home. And we have seen improvements in cooking confidence because of this curriculum. So since 2016, we've had over 2,300 individuals actually participate in Our Healing Kitchen. And we have noticed an increase in vegetable consumption from 2 times per week to 6 times per week on average. And then an increase in fruit consumption from 3 to 4 servings to about 5 to 6 servings per week. So really excited to share those outcomes and results with you. I'm very pleased by that. I just wanted to share a wonderful quote that one of the residents in a homeless shelter that was pregnant gave to us. I didn't realize how much I would love cooking before taking Our Healing Kitchen cooking classes. I learned that delicious, healthy meals don't always have to take hours to cook and prepare, and that it can be a wonderful bonding tool for our family. Thank you for showing our family how to be better versions of ourselves through the benefits of healthy eating, active living.
Awesome. Great, thanks, Michelle. And that last participant remark was, oh, there's another one here. I'm sorry, it's still your turn.
That's okay. I did want to share with Our Healing Kitchen the growth that we have. So over the years, we have gotten an increased request regarding youth programming for the Our Healing Kitchen. So we have small grants that are administered to use the Our Healing Kitchen model, where they can utilize the dollars for supplies, cooking materials, ingredients, whatever's needed to facilitate the classes. Over the years, we've seen that the youth agencies have really enjoyed doing this curriculum. And recently, St. Joe Health Foundation was awarded a grant to pilot the Our Healing Kitchen curriculum in the entire Fort Wayne Community Schools 7th grade class. So that's going to be serving over 2,100 students this spring. It will be done in the science classrooms with those teachers, and it's a 5-lesson program. So we're very excited to be working on that adaptation to Our Healing Kitchen.
Sorry about that. Now it's my turn, I guess, right, Michelle? Thank you. So along with the Our Healing Kitchen cooking and nutrition classes, Parkview and St. Joe have implemented the HEAL markets. And initially, the St. Joe Foundation actually operated those markets, but now we work with a partner, Health Visions Midwest, to operate and manage the market, and Parkview and St. Joe provide the funding and the support, educational support, and those kinds of things to Health Vision. So the Heal markets there's 3 markets, and they're located in food desert areas in Allen County. Health Visions, our partner, works directly with the WIC office and the Area 3 Agency on Aging to distribute the fruit and vegetable produce vouchers. So we are so fortunate here in Allen County that the WIC office will come and they will actually distribute those vouchers. And then we, Parkview and St. Joe, provide matching incentives, incentive dollars to spend at the Heal markets for all those vouchers. As well as we match all the SNAP purchases. VeggieRx is also accepted at the markets, as well as cash and credit and debit. There's plenty of on-site education and activities. So there's youth activities, and then there's often some tastings of different recipes that come from the Healing Kitchen curriculum. So there's a lot going on at the market. So really a lot of fun to go. Lots of happy people shopping for fruits and vegetables. This is another picture of the Heal markets this year, and this is the one that's located at the Parkview Greenhouse and Teaching Kitchen. And you can see all of our WIC families lined up to talk to our Allen County WIC office and get their vouchers and get their matching incentives. And then not pictured in this picture, we have our Aging and In-Home Services that's also providing the matching incentives. So once the WIC office sends out the text to all of their participants, we get big long lines at the markets, and it's really exciting and a lot of fun to see all the families as they come and join the markets and shop for their fruits and veggies. So we don't have final results for the Heal markets this year, and the WIC vouchers were delayed. So we do anticipate that may mean that this year's numbers will come down a little bit. But for 2021, we had approximate sales of $42,000 at all the Heal markets, and $28,000 of that was in incentives. So the matching funds for the WIC and senior vouchers and the SNAP purchases, as well as the VeggieRx last year and our Power of Produce coupons that we provide to the youth. Once they do some physical fun activities, they get coupons and can go shopping for the fruit and vegetables. So the approximate amount of WIC and senior vouchers that was cashed by our local farmers at the Heal markets was $13,500. And of course, they cash those themselves, and they just voluntarily report to us how much they're cashing so we can keep track of that. The Heal markets serve almost all low-income residents. Anybody is welcome, but because WIC, SNAP, senior vouchers, VeggieRx are all accepted, we have primarily low-income residents, but of course, anybody can shop using cash, credit, debit, those kinds of things. This year, we had all locally grown produce with local BIPOC farmers. The picture there of Bishop George McCowan, one of our farmers. And then on the previous slide, I'll go back actually, you can see some of our Burmese farmers. And we have about 10,000 Burmese residents in Allen County, and they primarily have a plant-based diet. So the farmers and the particular types of fruits and vegetables that are culturally appropriate to the Burmese residents are really, really popular at our Heal markets. And it's really fun to see all of the residents there. We have interpreters on site, and that always helps to make sure all the transactions go smoothly as well. So again, $42,000 in produce sales goes to these local BIPOC farmers, and $42,000 worth of fruits and vegetables goes to vulnerable residents in our community. So we're really, really proud of those numbers. As Michelle mentioned earlier, this Heal initiative has really been a launching pad for other initiatives in our community. And as we began working together and looking at various opportunities and really trying to talk to residents who are vulnerable, we realized that we could do more in this area. So in 2020, the St. Joseph Community Health Foundation was awarded what we called a Heal Expansion Grant. So it's a GusNIP grant from the USDA. And it is a SNAP matching program that we offer in 5 farmers markets right now. 3 of those are the Heal markets. And in 2 retail, we do have 2 retail locations year round, which is great. It's a co-op and a health food shop. They're not the ones that we anticipated. We had hoped to work with the Save-A-Lot stores in our county, but because of technology challenges as well as a change in ownership, we were not able to do that. So we've shifted gears and are working with 2 other retail locations, and they're doing quite well. We're hoping to add 2 more retail locations in 2023. We have a new public market that will be opening next week. So we're really excited about that. And we hope that there will be a produce vendor who will offer double up at that and hopefully accept a Veggie RX as well. There's a planned construction of a grocery store in Southeast Fort Wayne, a low income, low access area in our community. So we're really hoping that comes online in 2023 as well, and that we can offer double up there. So total, since the beginning of our double up or our HEAL expansion project, we have provided, it's actually more than 165,000. I just added some more totals to it recently. So we're about $170,000 in SNAP matching incentives to local families here in Allen County. So we're really excited about those numbers to see how much local produce is really getting out to families who are SNAP recipients. Now I will, I have one more thing. The impact of our Double Up program is measured by the Gretchen Swanson Center, and they partner with USDA, and they measure all of the SNAP matching programs across the United States that are GovSNP funded. So we provide standard evaluation surveys that are also being taken across the country. We have done more than 200 of those participant evaluations since we started. And the recent findings from the Gretchen Swanson Center show us that our double up participants or SNAP matching participants have a higher fruit and vegetable intake than the average American adult. And we all know that that has a positive impact on health outcomes. So we're really excited to see that, and we hope to be part of a really great effort to improve the health of residents here in Allen County. Now it's Michelle's turn.
Thank you, Mary. And I just want to say, like, we are very happy that we can introduce the health system in a positive light to a group of individuals that may not have had exposure in that form in the past. We are not only helping the local economy and access points and education for those in needs, but we're building connections. And I think that's what we love so much about the HEAL initiative, is that it has been the launching pad for a lot of other big initiatives that we've been able to do. And to complement and end our program, we just want to really talk briefly about Veggie RX to HEAL, which is our produce prescription at Parkview. It is a 3-year grant that is funded by the USDA. It was previously internally funded through community health improvement dollars here at Parkview. We started this initiative back in 2019 with 30 individuals, and over the next 3 years, we will be serving over 850 individuals just in Allen County alone. And we have recently received additional funds, and we will be expanding into 3 communities in our surrounding area, which includes LaGrange County, Kosciuszko County, and Huntington County. And so we're very excited over the next year to have the year to plan implementation of produce prescription in those communities, with hopes to go system-wide someday with produce prescription. And the goal of that program is to really help the at-risk population consume more fruits and vegetables, reduce barriers to healthy eating, and dispense health as opposed to medication by encouraging a healthy lifestyle change. Just like all of our programs, we really want to make healthy eating fun and make people feel like it's an opportunity to improve their situation. And so our prescription is $50 a month for 6 months, plus 4 nutrition education classes led by a registered dietitian. And currently we're partnering with farmers markets, but we are moving into retail space with Double Up, alongside Double Up, I should say, as they started first. And we are following suit to work on that partnership and build those relationships again with the retailers. So, and we just wanted to end on one last quote. from a Veggie RX participant that was using the Heal Market. This is such a blessing to me. I sincerely appreciate all of your help in caring for me and others and improving my health and well-being. It just amazes me how much I keep learning about produce, cooking, food preparations, and healthy eating habits, etc. Thank you so very much for everything. Everyone here is so nice and helpful. God bless you all. So with that, Mary and I are able to answer any questions you might have about our initiatives that we discussed today.
Hi, me first. Hi, I'm Jonathan Barclay. I'm from Indianapolis. And so here in Marion County, we're also working a lot on some of these kinds of initiatives. And I'm always thinking about the retailers and how we build partnerships with them to strengthen these kinds of programs and partnerships with them. And you know, so I was glad to hear you were really able to get a couple of retailers involved. But working with the larger chains like Save-A-Lot, there are sometimes some additional challenges that go with that. I'm you know, from your experience in you know, targeting and giving it a shot with some of those bigger grocery chains, you know, how might we, is there something that we should be thinking about trying to bring to the table that helps enable and equip those retailers, you know, to help them get to yes? You know, obviously technology, you know, problems can sometimes crop up, but obviously they're not insolvable because plenty of retailers do this. So is it technology or is it something else in the system, you know, that's actually the barrier? And what insights might we take from your experience about how to begin, you know, conversations with retailers to participate in this sort of thing that might be, you know, help them get to yes?
Yeah, that's such a good question, and I'll tackle it first if you don't mind, Michelle, because I went through the painful process with our Save-A-Lots up here, and we really had an owner that was really interested and wanted to invest in the community he was serving. So we didn't have to convince him of the benefits of it. That was really we were well ahead with that. But then the technology changes and the fact that he was part of a larger corporate structure really presented some obstacles. So I think that's primarily why with the independent grocers that we've worked with, the independent realtors, it's much simpler because they don't have to connect into a larger system and work with those technology systems, you know, on a corporate level. We have tried locally, our Fresh Time market is really interested in joining this effort. But again, it's that corporate structure that sometimes puts no onto it. And so the one thing that both Michelle and I have been fortunate to do is work, because we're GusNIP grantees, we have been provided access to the National Grocers Association, which provides technical assistance to us. And they are a fabulous group of individuals who consult regularly on the technology issues, as well as connecting retailers with other retailers who are making it work in their communities. So we have had so much wonderful consultation with the NGA, and I feel like they're making progress on a national level that will trickle down to a lot of the retailers and the corporate systems as they improve on that technology and really show the clear benefits in terms of profits and in terms of customer health and loyalty. And so I think I feel like we've got a good strategy. You know, we're working with the independents here locally and really making that work. And then nationally, there's a lot of effort to work at the corporate level. So I think it's coming, but it's definitely a challenge. Michelle, did you have anything you wanted to offer?
No, I think you summarized that beautifully. I will say I experienced a similar situation coming from a not-profit hospital. You know, we do a lot of community relationships in buildings. And as a registered dietitian, I never thought I would work with grocers as much as I have been. And understanding that they are for profit and having them see the value in participating has been an opportunity that Mary and I have had to participate in through educational opportunities. I see Seth Grant, who will be speaking in a little bit, also mentioned public recognition, which is absolutely true. Grocers really do like that. I think that does help promote their store and their services. But Mary has worked tirelessly on trying to get grocers in our area on board with the opportunity to double up and to produce prescription. So we're thankful. And that's kind of the model, is that we see these two programs going hand in hand. And that's how we have operated up here in Fort Wayne. You know, we started with double up and then we rolled out produce prescription. And so she's really led the race in this area for us to get into grocers and to start having those conversations. So when we rolled out produce prescription just recently in one of our retail space, it was a lot smoother for us than it was for double up initially. And we're very fortunate to have that groundwork and foundation already laid.
Yeah, thanks. And I thought one more thing just to offer on that. And we do have a couple other independent grocers that have not joined us. And Michelle, like she said, I've been kind of a bulldog trying to convince them. But in the end, I've had a couple candid conversations, and they don't make much money on their produce to begin with. And so for them to kind of incentivize more purchasing, sometimes it's even a loss leader from one of our markets. And so for them, in terms of profitability, it just didn't make any sense. And so I was happy that I had that discussion with them to really understand, you know, they wanted to help, but again, they don't want to lose more money either. That's just not, that doesn't make any sense. And so we've had some good discussions like that up here.
And that's why we're very fortunate to have the HEAL markets and other supporting markets with these initiatives. But as we grow and scale the magnitude in which we're going to be serving, we know we have to do more with the retailer space. And so that's what we're actively working on always.
Yeah, thank you. That's really tangible, helpful, practical insights into an issue that I think we all of us as advocates will have to continue to learn more about. If we can learn how to kind of learn that retail business more and more, so that we can understand where they're coming from and help them solve the barriers that it appears may be obstructing, and just have those insights. I really appreciate that. Thank you.
Absolutely.
Any other questions for Mary or myself? If not, we just want to say thank you for your time today, and we hope you enjoyed learning more about HEAL.
Yeah, thank you.
Thank you.
Fantastic. Thank you, guys. I know Seth joined us here today, so he is going to talk a little bit about some of the ways that local food is used in the healthcare setting here in Marion County at Eskenazi Health. They have some newer initiatives and some longstanding local procurement initiatives that occur there in that hospital. So I will turn it over to Seth, and Seth can talk us through a lot of the stuff that he has going on at Eskenazi.
I'm so sorry. I'm having some challenges today. Good afternoon, everyone. I'll apologize first by sharing that somehow this kind of fell off my radar and I don't have an official presentation ready for you today. However, I do know a lot about what we've got going on at Eskenazi Health, so I suppose I can kind of speak to that. As you all know, local procurement has been something that has been foundational for Eskenazi for quite some time. In the last 5 years, Eskenazi Health has moved from about 3% to over 70% local procurement. So about 70% of all the food that we buy comes from Indiana businesses, manufacturers, producers, farmers. We're obviously big supporters of the Indiana Grown program. I've served as commissioner for Indiana Grown for the past 3 years. And continue to support that program as much as we possibly can. I think one of the lessons that we tend to share with a lot of our colleagues and counterparts in other parts of the state and really other parts of the country is how the local procurement program has been super beneficial for our organization. While when we first started this initiative, people kind of looked at us like we were crazy because we were buying so much local or trying to buy so much local, and there was always this concern that it's going to be more expensive, right? I think that one of the things that we've proven is it's not only not always more expensive, but throughout the pandemic, it was actually something that allowed us to continue to have much less supply chain challenges than what most of our counterparts had, because we had built those relationships with the local farmers and producers and manufacturers. And in recent months, or even the past year, as we've continued to see transportation costs skyrocket through a number of reasons I won't get into, but really labor shortages, labor expenses, fuel expenses, et cetera, have really driven the cost of transportation through the roof. We're actually able to purchase many of our goods at a less expensive than what some other folks might from broadliners, and still have a higher quality product. So, you know, I don't know that I need to sell this group on the idea of local procurement, because it's something that I think we're all in alignment with, that it makes sense. And one of the things that it's helped our organization with tremendously is our ability to focus more on scratch-based cooking. So when you're procuring locally, obviously there's a lot more opportunity to buy what we call raw ingredients to cook with. So you're not using as many convenience products. There's not a list of ingredients on something as long as your arm that you can't pronounce. You know, most of our recipes are 6 or less ingredients, to be honest with you. We're all about continuing to provide a fresh, wholesome meal to our patients, but also our visitors, our staff. This isn't just isolated to one group. The food that we prepare is prepared for our patients, but also everybody else. You know, oftentimes I'll share that Eskenazi Health is serving the same proteins as what you're finding at some of the high-end restaurants in downtown Indianapolis, where they, you know, brag about how they're buying this local beef from a local farmer. And I always joke, because they're charging like $25 for a burger, and it's the exact same beef that I'm serving to my patients, probably in a larger portion, but it's the same beef. So, you know, Eskenazi Health continues to focus on local procurement initiatives, ways to support our local farmers. And we've continued to do that through the expansion of our medically tailored meal program, which you may have heard of. Eskenazi Health is continuing to grow our medically tailored meal program, which is a program that initially started in collaboration with Meals on Wheels of Central Indiana to find a way to reach those outside of the service area of that program. And currently we are delivering meals to all 92 counties of Indiana through that program, primarily to the participants in the Ryan White program, Ryan's Meals for Life. So Ryan's Meals for Life is a program that is sponsored by the Ryan White Foundation for those individuals living with HIV or AIDS in Indiana. And so currently there are, and I don't know the exact number, so I don't want to say for certain, but I want to say there's been over 1,000 participants in that program throughout the state of Indiana. And we drop ship those meals weekly to their homes directly, and continuing to look for partners throughout the state to grow similar programs outside of the Ryan's Meals for Life. So we've started to supply some other healthcare systems with some of our meals to utilize in their local Meals on Wheels like programs, and as well as partner with other Meals on Wheels like organizations throughout the state to supply these meals. And the cool part is, not only is it a medically tailored meal that we can kind of specify which diets that it works for, but again, over 70% of the ingredients utilized in those meals is coming from Indiana farms, businesses, and manufacturers. So as we continue to scale that program, we continue to see the benefit throughout the state, because we're not only focused on the physical health of our community, but also the economic health. So it allows us to continue to grow that. In the coming months, we anticipate growing out into a USDA inspected facility, which will allow us to distribute across state lines, which will be an even better opportunity for our local businesses, farmers, manufacturers to be able to get their goods out into other healthcare facilities. We've had some schools have interest outside of the state. We've even had some large food service contract groups interested in distributing our meals into some of their programs. And so as we continue to grow that program, obviously we see economies of scale, which allow us to continue to put money back into growing that program, add additional SKUs, and additional support opportunities for the program. So we're pretty excited about that. And that kind of ties into a little bit about what you may have seen recently. We just officially had our grand opening of the Fresh For You Market at Eskenazi Health. It was a tad bit delayed because the market has actually been open for just over a year in its current capacity. However, we actually opened the Fresh For You Market in early 2017. The initial vision that we had with the market was our outpatient nutrition team has done a fantastic job of growing nutrition education in our community over the last 10 or 11 years, and has really made a difference in Marion County around how to teaching people how to cook and how to read nutrition labels, et cetera. I think where we found that we were falling short was the access. So bridging the gap between the education and the access was really the intention behind the Fresh For You Market initially. So we started that in a small corner of our cafeteria in 2017. And I think we found that it was super beneficial to not only our patients, but our staff. Certainly throughout the pandemic, it proved to be invaluable because we had a grocery store on site when many other grocery stores were either closed or completely empty. We were even stocking toilet paper for quite a while. So that was a good opportunity to support our staff, of course. And then fast forward to 2021, in September, we moved into our new location at the Frank and Katrina Basile Pavilion on the common grounds at Eskenazi Health on our downtown campus, which is steps away from the bus line, which has been really cool to help support individuals that don't have access to groceries. We're continuing to work towards getting our new POS system, which has proved to be a little more challenging than I'd anticipated, to be honest with you. But going from a food service guy, which I've been most of my life, to trying to operate a retail grocery store is a little bit of a learning curve, as some of you might be able to understand. So we've learned that we need a different POS system to support a grocery. And in order to be able to do the SNAP and the Fresh Bucks, the doubling program here locally. So we're working in collaboration with the city of Indianapolis, who's generously agreed to fund our POS system to get that installed. I think the cool part about that particular program is that
I think we lost him. He should be back shortly. I know he's on the road today. There he is. Hello, Seth.
I'm so sorry. I was disconnected.
You're
I'm
good.
having some connectivity challenges today. So I think you all heard me talk about, I got up to the point where I said the cool part of the POS system
Yes.
is going to be that it is going to allow us to do online ordering for grocery and pickup, which we anticipate will be a huge win for the program, but really for our employees. We have a captive audience of almost 3,000 employees every day that could be leveraging the grocery store, and to the extent that they can, they do. I do think that the online ordering is going to increase that. And the reason why that's important is that our Fresh For You Market model is different than anything else that we've really seen across the country. I can't tell you that it's not existing anywhere else, but it's nothing else that we've seen, in that we are a grocery pantry hybrid, in that we're open to the public and encourage and need the public to shop there. So me, you, and all of my colleagues, and every penny that we earn in margin through that traditional shopping experience goes back into support what we call our pantry program. which is vouchers that get distributed to our patients in clinic when they screen positive for food insecurity. So
You're good. We can still hear you. Oh, we lost him. I'm sure he'll be back in a few seconds. Getting to the good, exciting part. There he is.
I'm so sorry. I had to join via phone because my computer's not working and I just keep getting phone calls. So
It's
hopefully
okay.
you can hear
You're
me
fine.
again already.
Yeah, you're good.
So where I left off was that our voucher program is funded through the traditional sales, and we screen or are working towards what we call universal screening in all of our clinical spaces. So inpatient and outpatient, we're screening for food insecurity. When those individuals are screened positive for food insecurity, they're given a voucher on their after visit summary through their appointment, and they're able to redeem that voucher in the grocery store. They're able to redeem that voucher in the grocery store for $30, which is really just what I continue to call kind of a Band-Aid solution. We know that. The goal is, though, once they are I'll say enrolled or referred to that program, we're not just giving them a voucher, but we're connecting them to a lot of wraparound services. So think of all the things that keep people food insecure, the barriers that exist, such as housing, transportation, childcare, workforce development, resume writing. I've even said, I think we need to be focusing on things like getting somebody a haircut and a nice outfit to wear to a job interview. Those are the things that we are continuing to focus on as a social determinants of health team. So it goes beyond kind of the pantry, and really, you get the food, you get your temporary, here's going to get you some food on the table tonight, but how can we get you to a point where you can sustain that yourself? So that's kind of what we're focusing on with the Fresh For You market. We've hired SNAP outreach coordinators to focus on nothing but SNAP outreach in our community, which has just been fantastic. We have partnered with FSSA on that project as part of their SNAP outreach plan. Currently, we have 4 SNAP outreach coordinators in our system, 2 of which are 100% dedicated to our federally qualified health centers. So they're out in the community working in our clinics. And then 2 that are able to be a little bit more flexible within the system and work downtown and work in partnerships with some of the food banks and pantries in the area. But those individuals also work within the Fresh For You market system and connect with patients or even community members who aren't patients that need help navigating the SNAP program. Every opportunity I get, I share this statistic, and you probably read it somewhere where I've said it because I say it all the time. But when we first met with FSSA regarding the SNAP outreach program, and really what struck me and made me grab onto this and not let go until we made it happen was that they shared that in Marion County, over 70% of the denials for SNAP were folks who would have otherwise qualified had they just done the application correctly or in a timely manner. So if you think about that, 70% of the people who were applying and being denied should have gotten the benefits. They would have qualified for the benefits if they could have just navigated the hurdles associated with the application process. So we see the SNAP outreach program as being a huge benefit to the individuals living in Marion County, whether they're our patients or not. And really beyond, we work closely with Gleaners, who also has a SNAP outreach program, and Gleaners is able to better support folks outside of Marion County. However, the program for us is still in its infancy, but we really see that there's going to be some benefit to that. We're seeing the benefit already. But as people come in, and to kind of tie it back to the Fresh For You market, as someone comes in, we can help identify whether they're available for, whether they would qualify for SNAP benefits, and then help them navigate that so that they're not as reliant on the pantry. We also have a program that we started this year that is our Community Weaver program, which is very similar to a social worker in many systems, but our Community Weavers actually go out and work with different programs and organizations throughout the city and identify opportunities and resources that already exist out there to connect our patients and community members to those resources. So again, as we engage individuals, we're giving them that Band-Aid solution, but we're also connecting them with longer term solutions. The other really cool part that we incorporated with the new iteration of the Fresh For You Market is our partnerships with really local minority-owned restaurants and catering partners. We have started to feature one of our local partners in the Fresh For You Market every month. They kind of rotate, and because oftentimes our partners are too busy to leave their home store or their home restaurant, we collaborate with them on those menu items that we're going to serve for lunch there, and then we advertise for them. So we'll buy some proprietary ingredients from them, but our team will actually prepare the food inspired by their recipes, and then we advertise for them so that you may have lunch there today. 100%, by the way, of all proceeds going back to support the pantry portion of what we do. And then the idea is you may grab a flyer or some information and take your family out to eat at their restaurant this weekend or next weekend or whatever. So it's a win-win opportunity, really, and it allows our employees and visitors on the campus to experience some diverse food that they may not otherwise get to experience, but also gives us an opportunity to bring in a little bit of revenue to support the pantry portion of what we do and advertises for those restaurants. So it's a real win. Building on the success of that particular program, we did make somewhat of an unofficial announcement only because Cummins made the announcement first, but we are in the process of renovating a bus that was donated to us by Indigo, and turning it into the Fresh For You Market on Wheels, which will be a mobile version of the Fresh For You Market, and it'll have all the same aspects of what I just described, but on a bus. So we know that there are several areas throughout the city, primarily the areas that our federally qualified health centers are located in, that could utilize these services. So we're working on a schedule where we will park the bus every Tuesday at this location. We'll advertise it so everyone in that community can count on the fact that they can come get their groceries at an affordable cost, and/or utilize their SNAP benefits, use the doubling, but also benefit from some nutrition education. We will have a full-time health coach on board the bus. We've built out, actually off the side of the bus, we've built out a nutrition education window, we call it, with 2 large screen TVs. So you'll be able to see when standing in line or standing outside the bus, you'll be able to see the instruction. But our health coach will be doing some instruction on how to, it could be as simple as how to incorporate an avocado into your diet, or how to read nutritional labels. We really anticipate the health coach will travel through the bus with individuals to teach them how to shop, or what to look for on the nutritional labels and certain aspects of just shopping in general. We're also going to have a cook on the bus and have a small window off the other side of the bus that will act as almost like a food truck to sell the same type of foods that we're making in partnership with our local minority-owned businesses. So again, the exact same business model, only on wheels. We're excited to see how it works. It's obviously a lot more compact, so it's been a little challenging to fit all aspects there, but we're navigating those challenges and working through ways to restock the bus throughout the day as needed. And then we do have some plans to potentially build out some additional brick and mortar locations in some of our federally qualified health centers throughout the next year or two. But that's a really big program for us and something that we're proud of, and we think we'll continue to see success. We've partnered closely with Gleaners to procure as many of the grocery items as we can from a purchasing perspective. Obviously, we're not doing donated food at this time on the bus because we are selling it. However, we're working through some potentials to do some smaller food distributions of pantry items as well. But I think the important thing to note about our pantry program through the Fresh For You market is it allows our customers, or more importantly, our patients, to shop with dignity. And I've said for a long time, I think that the stigma associated with shopping in a pantry can be just, it can have horrendous effects on our patients. And in this case, nobody knows that you're shopping in a pantry, right? The only person that knows is you and the cashier. So I think, as I said, it provides a dignified shopping experience. You're not being told that you can only select from the items in this corner. You're able to make the same choices that everybody else is able to make. And our goal is to have the education there to allow you to be informed about those choices. And we think that it's going to continue to be a successful program. Like I said, it's still in its infancy, but we're already seeing a lot of excitement around it, a lot of participation, and our patients are extremely grateful for that opportunity. So I think in a nutshell, that might be most of the programs that I wanted to share. Of course, we do have some other things going on through our social determinants of health team and some of the things that we're working on. However, those are the highlights. The big and exciting project for me right now is the Fresh For You market, as well as the potential expansion into a USDA kitchen for the medically tailored frozen meals. The medically tailored frozen meals will also be available in the Fresh For You market. So it's a cool tie back to both of those programs. But I'm sure there's probably questions and things that I missed. I apologize. I didn't have access to my computer and didn't have a formal presentation pulled up for you, but happy to answer any questions you might have.
Fantastic, Seth. Thank you so much. I think you did a great job without any form of a presentation. I'm sure a lot of people learned a lot of things today. So for the remainder of the time that we have, like Seth said, please raise your hand or jump in, ask some questions. If you don't have access to the microphone and just want to put it in the chat, I'm more than happy to read that out for you.
I'll also add that if there is any interest in any of our programs and you want more information, you can reach out to me as well, privately or separately from this group. As I said, we are continuing to work towards distributing our medically tailored meals outside of our system. So if you find that there's a need for them, I understand that just to be clear, we price everything at a point where we're not making margin. So it typically ends up being much less expensive than buying from a for-profit organization who very likely is not sourcing local ingredients. So if there is a need for the meals, or you find that it would make sense to partner with an organization that you work with, let me know, and we can help you out. We are distributing our meals through Piazza Produce and Specialty Foods currently, which I think they're backing their trucks up to about every dock in the state at this point. So there's a lot of opportunity there. But happy to answer any questions offline as well if you want to reach out to me.
We have a question in the chat. As long as USDA approval comes through, would the medically tailored meal distribution be available to child care programs?
Yes, absolutely. And yes, it would be. And as long as the programs are in the state currently, we have the ability to distribute the meals to those programs now, as long as we're self-distributing. So there's some logistics associated with that without the USDA approval. However, for example, I don't think we're in any child care programs, but we are in some adult day center programs currently that we are just self-distributing to, which we are allowed to do without the USDA approval.
Do you have any other questions for Seth or for Mary and Michelle? I know you guys got a lot of information today.
Thank you all for the opportunity to present. And Mary, Michelle, I appreciated your program as well. And likely we'll have some follow-up questions for you that I may reach out separately on. I love what you guys are accomplishing up there. And if there's anything at all we can do to support, we'd love to do that, and really maybe even pick your brains on how we could make some of the work that you're doing there happen in Marion County as well.
Yeah, Michelle and I have already talked about coming to visit you possibly, so we'll reach out.
Yeah, love to host you for lunch one day and show you the Fresh For You market.
Thank you.